This is my video in response to the discharge teaching pain management portion of discharge for our patient Rebecca, who was previously shown on the video that we responded to. First of all, I would say that each patient, including Rebecca, according to our Bon Secours core values, and there are 7 of those, but the ones that really hit home with me as far as this situation are respect. Each patient that we have that we provide teaching or care to deserves our respect regardless of diagnosis, race, economic status. They deserve equal treatment. They deserve quality treatment, and they deserve compassion. We never know what reason the patient has ended up homeless, why she had a struggle with pain medication. We never know unless the patient relates to us the story behind some of her issues. And we can't just be judgmental in that area. We just have to treat everyone the same. I hope that after I've been a nurse, I've been a nurse 20-some years now, but I hope that I never get to the point where I prejudge my patient based on any information like that. Of course, our mission is to bring compassion to health care and to be good help to those in need, especially those who are poor and dying. I would say if she's homeless, she fits the poor portion, but Bon Secours reaches out to everyone and treats everyone as an individual and treats all problems and diagnosis individually. With this particular patient and her pain management, she might have pain. I don't know if she was a C-section or a vaginal delivery. She could have pain associated with either of those. I would go over with her what kind of pain she should expect, what is too much pain, and what is an acceptable level of pain related to her healing process. Also, we would need to teach her the signs of an infection, as with a C-section or a vaginal delivery. You can have infection with either, but teach her those symptoms and the increase in pain levels that are associated with an ongoing infection. Let her know what to look for and to expect. As far as pain relief for vaginal deliveries, we can teach her about sitz baths. We can teach her about the cream that is sent home with her to relieve some of that pain. Ice packs can be used if that's something she finds comfortable. With C-section, we would teach her, of course, with her coughing, to brace her incision with a pillow, just different ways to move to avoid too much stress on that incision site, and just reinforce that teaching with her. If she's breastfeeding, she may have pain associated with breastfeeding. We could let her know that there could be some chafing. That's uncomfortable when your clothes touch the breast. We could teach her about using breast shields. There are ointments for this particular type pain. We could educate her on that. We would also need to assess her ability to access these things, and that goes into a whole different area that we would need to assess as far as her where she'll be going when she leaves the hospital. If she has access to things to keep clean and to prevent infection, that would open the door to the homeless situation that we would need to bring in a lot of different resources for. But just focusing on her pain, she did have some concern about her pain management. We do know that she has a history of some problems with narcotics. I would have to be very upfront with her about that and very tactfully say to her, no, this is to benefit you and your newborn. We need to be completely honest with each other. Is your narcotic abuse current, or was that a history? Where do you stand right now as far as using narcotics? Depending on her answer, again, we would just individualize that discharge care plan and her teaching. If she has a current problem, we would try to avoid the use of narcotics, and we could stay more with Tylenol and Advil. And that would become important to teach her the level of pain, the pain scale, 0 to 10. If your pain level is 5 and under, more than likely it can be handled with Advil or Tylenol. But again, you just have to assess where she is at that current moment of her discharge. You would want to ask her what typically helps her pain levels in previous times that she's had pain, what has been successful in treating her pain. At the end of this teaching, ask her to discuss what you've discussed with her. That's a way to assess what she's actually heard. Has she been distracted? Is she actually interested in what you have to say? Is she interested in, if she's off narcotics, staying off narcotics? Or was her questioning her narcotic discharge pain medication a way of continually seeking narcotic medication? But it would be very important at the end of your teaching to just assess what she has learned.